All right, ladies and gentlemen, we're here to talk about structural integration and how massage therapists, physical therapists, chiropractors should learn this information to be able to apply it into their practice to make consistent long-term changes, and why we need to specialize in being able to allow our practices to be more successful and help our patients at a higher level. So here I have Gwen.
Hello.
Gwen has been practicing for almost 9 years.
Almost 9 years, yes.
So that's a pretty significant landmark. There's not a lot of massage therapists that make it to that 9-year landmark. So you started training with me to learn to become a structural integrator about almost 4 months ago.
Sure.
So, long time as a massage therapist, transitioning into the world of the Rolf method of structural integration. How significantly effective is it with your patients so far?
It's been very dramatic. The change has been consistently deep and effective without a lot of extra work on my part. It's been very precise. Issues with low back, runners have had consistent problems, and then using these techniques has just given them the relief that they need, and they've actually felt it like immediately getting off the table. So rotation, they're turning off the table, it has been much improved, and then in their activities or their exercise, it has stuck with them and allowed them to continue to exercise at a really high level without the pain.
So would you say you're seeing more changes with your patients with the structural integration compared to the traditional massage treatments?
Absolutely.
They're lasting longer.
Yep.
What is your opinion about how easy the work is compared to, let's say, if you had 6 or 7 structural integration sessions versus 6 or 7 massage therapy sessions in a day? Mm-hmm. Which would be easier on your body to be able to do the work?
If I were to do 6 or 7 massages in a day, I would be completely exhausted at the end and just really drained physically, tired. With structural integration, if I put these pieces in, what ends up happening is that I am working more precisely with a lot less of this physical sort of back and forth with the Swedish or the deep tissue. So it's precision, it's accuracy, and it just doesn't seem to be as taxing on my body. With the proper mechanics that you're showing, I would say it's 75% easier.
So, and that's a good question. We know a lot of people end up getting injured because of body mechanics issues. Mm-hmm. What are you learning in this training about body mechanics?
Okay, quite a bit. First of all, save your thumbs. So we're not using thumbs like going down the spine. We're not using them as like the fulcrum of pressure. They're not meant to be that. So instead, we're learning to keep our sternum underneath, or over, and our clients underneath. So what ends up happening is in that you've got your body weight really driving the pressure and the action, and then it seems like the focus is so much clearer, and then the results are more deep with less actual physical muscle pushing. So you're not pushing through something, you're allowing your body weight and then that action to just make the change in the client.
And when you're saying deep, you're not meaning painful, correct?
No, absolutely not. No, not deep in that respect. I mean, we're still keeping very clear focus with the client, so they're communicating with us at a really effective level. We're sinking into fascial layers, which I'm sure massage therapists have experienced this. You can be kind of kept at a more superficial high level because of the fascial binding. So as that starts to open up and you go more deeper, you're accessing more of the smaller muscles and you're getting more change. So that's the soft sinking into deeper tissue.
Fantastic. So being a massage therapist for almost 9 years, you've had a lot of continuing education. Mm-hmm. Have you seen anything else like this?
Absolutely not.
Absolutely not.
I mean, other classes will teach you a few things that are great, but they still require a lot of energy. Mm-hmm. And then is the client going to go back to that same problem, down the line? This is working from a structural level. So actually finding the solution and implementing that with the client. Very different.
One of the things that we see in the massage therapy industry is that people kind of become jack of all trades. They get certified in, Swedish and injury and myofascial release and lomi, orthopedic massage, all of these different things. What do you think that you're going to see in your practice as you're becoming a specialist in the Rolf method of structural integration? Do you think that you're going to be able to help your patients at a more refined level, kind of specializing in something versus doing, a handful of things all at the same time?
Sure, and I did that same continuing ed, trying a lot of different things, even in my initial training. And what I really found that I was gravitating toward was the actions that are going to lead to more postural and significant changes. So it's amazing that I'm here now with this. I realized too that as we look at any individual body, we have to take into account all that they do, that they have done, their sports, where they want to be going. So this training is going to provide that foundation for getting people healthy systemically, instead of just one local area.
Right.
Okay, so we're treating something because we know there's pain there, but where's the pain really coming from? And as soon as you open up and look at that bigger model, right, because everything is connected, then you can make the change that is going to be lasting and really provide more profound health. Not just in one area, oh, my leg feels really good, but wow, the back, and then the lower legs, and then the feet. So much, much, much more profound.
So would you suggest and recommend someone to receive this training? I mean, do you have to be practicing for a long time? Could you be a newer practitioner? Could you be kind of in the middle? Do you think there's any limitations on why someone would want to become a Rolf method of structural integration practitioner?
I think as you experience more people, perhaps the effectiveness would become more obvious if you've seen and you've tried more.
Mm-hmm.
But the other side of that coin is that, wow, do you want to spend so much time trying all these other things before you come to the method that is the most effective? And we want to be helpful for our clients. We want them to feel great and be through the pain and actually then progress. So we're not just maintaining. If you have the tool immediately to help people and just excel in what they're wanting, as opposed to just being okay for now, being okay for 1 week or 3 weeks, you of course would want, long-term health and longevity.
Yeah. So in regards to making immediate changes instantaneously,
absolutely,
changes that are lasting for the long term, which is what our patients are looking for, and the ease in which your body is able to do the work as a therapist, so doing it for a long time period. Have you seen anything else that is doing what structural integration is doing?
Absolutely not. And I am so excited to put my daughter, young baby girl, through this, because I can see that she's starting to do actions, and my husband as well, recognizing that you don't have to be in pain to receive this. You'll be in better structural position for everything else that you encounter.
Yeah. So
we really all should be structurally integrated in an organized fashion. There's nothing that does it better. It is safe. It is incredibly effective. And really, it's beautiful work. I mean, sometimes it has that reputation of being very aggressive and painful, but we're not doing that. We're doing very precise work on young, middle-aged, high athletes, and older people, and they're all getting these tremendous results. So I'm blown away.
So people in Florida, Alabama, New Orleans, wherever we're at in that southern region, wherever you're at, anywhere in the country, you would recommend it?
Absolutely.
Fantastic.
Absolutely.
Thank you.
Thank you.
Have a great day.
Yeah.